Hey everyone, welcome to The Doctor's Journey. For our episode, our very guest is Dr. Alex Schüpper. How are you doing today?
Hey, Sohani, this is Alex. Thanks so much for having me. I really appreciate the time. I'm doing well. Today is our academic day, so I was able to work on some research and spend some time outside the operating room. So it was pretty productive. How about yours?
That's good to know. My day went really well too. Lots of classes. So what would you like to tell our viewers a little bit about yourself?
So just to introduce myself, again, like you mentioned, my name is Dr. Alex Schüpper. I'm a neurosurgery resident in New York City, and I'm here to essentially provide resource for you guys to answer any questions you have about either the journey of becoming a doctor or becoming a subspecialist in medicine, and really here to help you guys and give you guys some perspective of someone who's been through it, if you will.
That's awesome. I totally agree. Have you always wanted to be in the medical field, or was there a particular moment when you decided that this was it?
So it's been a really long time that I've known that position. I have a bunch of family members who are doctors. My dad is a surgeon, and I really always knew that I wanted to not only be in medicine, but to be an interventionalist, as in someone who performs procedures every day. So it's been a really long time. I would say probably since high school, I knew I wanted to be in medicine, at least.
Perfect. How does it feel to be a med student? What were some difficulties that you faced?
So it can be very challenging to be a medical student, but it's incredibly rewarding at the same time. For the first time, people are really placing a lot of trust in you. They're telling you their most personal information. They're exposing themselves both literally and figuratively, and they're relying on you to heal them and to be able to help their problems and make them feel better. So it's a huge responsibility. It's a large learning curve. As you know, medicine, there's an immense amount of information that you have to learn, and the reality is you're never going to learn all of it. So you have to figure out the best things to learn and the most effective way to learn to do well by your patients. I feel like all med students really go through many challenges at different stages in their training, especially during medical school. I would say the first year, the challenges can revolve around just knowing your way around the hospital and learning how to talk to a patient appropriately, learning how to examine a patient. And this is something that you progressively will improve on during your 4 years of medical school, that hopefully by the end, you at least have a basic knowledge of how to perform a history and physical exam, how to take a focused history, and how to create a differential diagnosis for really anyone that comes into your office or into the hospital.
Yeah, I definitely agree. Personally speaking, I'm into medicine, because I just feel like it's such a gift to be able to help others in a time where, they're the most vulnerable. And not only that, I also feel like every day is literally like a learning experience, because you're getting to meet all these new people and you're getting to learn more about yourself as well. Personally, I was first intrigued by medicine because I really like the sciences, but I feel like the more I got to explore the field, and especially being where we are today, I just think that the different healthcare disparities had also stood out to me, and basically wanting to make the world better from a holistic point of view. So yeah, I feel like there's definitely a lot of introspections when it comes to the medical field, and I definitely agree with all the points that you made. What is the process that you need to follow to get into the medical field in the US?
So it depends where you're coming from. It depends on your experiences. At least in the United States, you have to go to college for 4 years. You need an undergraduate degree, or the equivalent. So I suppose also junior college and have enough pre-med requisites. You have to take the MCAT, which is the standard admissions test in the United States to get into medical school. Nowadays, medical school admissions is becoming so competitive that you also need research experience, volunteer experience, and a good amount of extracurricular activities to be competitive enough to be considered for medical school.
Mm-hmm. Do you have any advice for like the students who also want to pursue the same career?
So for students who want to pursue really any type of medical career, I mean, there's no substitute to hard work. I wish there was an easy get around to not having to take the MCAT or not having to take your pre-med classes, but the truth is you really have to be successful on multiple levels. You have to get good grades. You have to study hard. You have to do very well on your MCAT if you want to get into some reputable medical schools. And I would highly encourage people to conduct research. It doesn't have to be the highest level of research, but you have to be able to engage in the sciences. You have to understand basic science, or else it will make learning in medical school much more challenging, because all the physiology you learn, it all grows from much of this knowledge of basic science. And if you understand everything from basic biology and chemistry and building from there, it will be very to appreciate how the different systems in the human body work. And so it all builds. And having a really strong foundation, which you'll receive most of that knowledge in college, is really important. And I think it demonstrates well in the U.S. medical training system.
Definitely. Speaking of college, do you have any memorable experiences that you had like during one of your internships or one of your university classes that you would like to share with us?
So I had a really great experience in college. I went to Johns Hopkins and just loved it. I made a great group of friends and participated in some awesome extracurricular activities that will stick with me forever. For me, the biggest thing was surrounding myself with a really positive network of students. It can be really tough as a pre-med student, where you're often in more of a cutthroat environment. Everyone's trying to do better than the next person because everyone wants to top grade, and it can be really challenging environment. So I was really fortunate that I surrounded myself with a good social circle of people who were really supportive, and we all studied together and worked hard together and really built each other up. And at the end of the day, we were all very successful. And I think that was really integral to me being successful in the next journey and really carrying me through into medical school.
Perfect. What were your networking experiences like during your time at Johns Hopkins? Like, for instance, do you think it was often accessible to, when it came to finding internship opportunities? And if so, like, what are some necessary requirements that you think a student should pursue in order to make the most out of the opportunities that are around them?
So it's a good question. Again, I was very fortunate to go to Johns Hopkins, where there's a very rich healthcare culture and medicine and global public health culture. So it wasn't that hard to find opportunities. Throughout the hospital and the medical campus, they're always looking for undergraduate students to conduct research, to volunteer, to participate in different types of activities. So it wasn't really challenging there. I definitely feel for students who have much more limited resources. But especially nowadays with the pandemic, everything is now remote, and it's much easier to connect with different people. For example, I often give lectures to different medical student groups and organizations, and the access the students have today is infinitely more robust than what I had when I was in college. There's no way I could listen to a neurosurgeon in New York City when I was in Baltimore in college, versus now it's very easy, and the world is truly connected in a way that it wasn't over a year ago. So I think with that opportunity, students, especially those who don't have the same resources in college or in high school, definitely have an opportunity to bridge that gap.
Yeah, definitely. How did COVID-19 personally impact you in like the workplace, at home, and like basically like your everyday life?
So COVID definitely had a large impact on last year of residency training for me. Being in New York City, we were truly the epicenter of COVID-19 when it hit early last spring. And it totally changed our curriculum. I was taken out of the operating room. I was treating many really sick COVID positive patients, both in the ICU and the emergency department and throughout the hospital. So it definitely affected my training. But I think through that, we all learned really how to deliver healthcare in an effective way, and it really challenged us. But it reminded us of why we're in medicine in the first place, and that before we're neurosurgeons or orthopedics or pediatricians, we're all doctors. And at the end of the day, that's what matters the most. And when the pandemic hit, we all really had to step up to the plate and kind of step outside of our job description, if you will, to care for patients. So it was a really humbling time and very sobering. But looking back now, as I'm optimistic that we can now kind of look back on this moment, as I'm optimistic that we're beyond the kind of the peak of it. It was a incredibly rewarding time in a weird way to be able to take care of those patients and to really part of that team was truly powerful. It's definitely an experience that I'm never going to forget.
Yeah, definitely. Are there any changes that you think should be made to the healthcare structure today in order to increase equality and improve accessibility?
Absolutely. I think that's a great question. And if I had a good answer to that, I would probably have a lot of money and have a lot of people listening to me. I wish it was that easy, that there was one change or even a couple changes that could make healthcare more equitable for all and improve accessibility. I think the Obama administration really moved that in the right direction by increasing the amount of people who have access to care. As we've seen, there are definitely some shortcomings to that plan, and just socialized medicine as a whole has some potential shortcomings, as we've seen in other countries that have more of a socialized infrastructure in terms of delivery of healthcare. But I think the general concept of improving access to care is really important, especially in this country that's built on capitalism. And I think it's incredibly important. Honestly, I'm not exactly sure the easiest way to do it, especially in a country like the U.S. that's already so capitalized in terms of the healthcare delivery. I mean, if you look at our economy, 1/6 of our GDP, our gross domestic product, goes toward healthcare, which is larger than any other country in the world. So I think when you start off against that elephant, it's really hard to overcome. But I think we're slowly moving in the right direction. But it's obviously dependent on leadership in this country.
Yeah, definitely. What are some ways that you think general members of like the community can basically contribute in terms of overcoming these healthcare disparities?
So if we're talking about disparities and not just improving accessibility to care, that's a totally different story. I think there are many things we can do to improve healthcare disparities. I think that one of the biggest things is just public health and awareness. I think the disparity in health awareness in this country is incredibly vast, and we see it in pockets of lower socioeconomic status, that there are many things that we can do as a community to improve health disparities. And it doesn't just mean giving out healthcare to people. There are many other ways, just by informing the general public. Primary prevention of disease is one of the largest factors. If we can find ways to reduce the rates of heart disease, diabetes, obesity, all these predisposing factors that are vicious cycles and lead to lower access of care, and that further this disparity gap, I think that would create a huge improvement in this country. But again, I think it all starts from primary prevention, really on the battleground of the primary providers and just public health officials really starting this, so that by the time we get to these patients, they haven't already developed all these conditions and comorbidities and are at increased risk. We see that in the case of COVID, where people who have obesity and lung disease and heart disease, these people who, when affected with COVID, tended to do much worse than their healthy counterparts. And we see that's related to race, to ethnicity, to socioeconomic status, right? And these things aren't coincidences. So I think by improving primary prevention of just basic disease, of reducing obesity rates, of improving basic public health factors like smoking and healthy diet and things like this, it can make a huge difference in terms of this country and how we're spending these healthcare dollars.
Yeah, I definitely agree. Do you have any thoughts on like the current distribution of the COVID-19 vaccine?
Um, without getting political, so I would say it's definitely picked up and moved in the right direction. There have been a large number of Americans who have now gotten the vaccine. Over a quarter of adult Americans have now received the vaccine, which, if you look at how many received it a couple months ago, is truly an impressive number. It's more impressive than I think anyone believed Joe Biden would actually be able to do once he became president in January. So that's definitely a step in the right direction. However, kind of an interesting debate that I've been listening to is hearing about delaying secondary vaccines, meaning the second dose of the vaccine, to people who haven't gotten the first dose, because people who get the first dose, just receiving the first dose is actually pretty effective in terms of warding off COVID, or at least being able to infect others with COVID or having severe symptoms from the disease. So public health officials are making the argument of maybe we should hold off on giving some people the second dose in exchange for using those doses for the first vaccine. So I think that will require a little bit more strategy and planning, but I'm optimistic that in the next couple months we'll be approaching hopefully what's going to become herd immunity. But we're still far away from there. Estimates have thought that between 60 and 70% of the population are needed to be vaccinated to get to herd immunity with this virus, similar to other viruses or other pandemics that have required herd immunity to be effective population control. So we're still not there yet, but I am optimistic that we're moving in the right direction.
Yeah, definitely. I agree. Yeah, so basically, thank you so much for being here today and for taking time out of your day to talk to us. I think all of these are very wonderful ideas, and I feel like a lot of our viewers are able to like learn as well, especially those who are looking to get into medicine and look into like the different intersectionalities in the healthcare system. So yeah, definitely had a great time talking to you today, and thank you so much.
Thank you, Sohani, and thank you to Med and Ed for the time. I really appreciate it.